Then we have arousal disorders, which mean that you have difficulties in becoming aroused in the body, especially in the genitals, meaning that you will not lubricate, the woman will not lubricate, she will be dry. And that is something that we see especially in postmenopausal women after they don't have estrogens anymore, but also if the women are not stimulated the right way, premenopausal women, if they don't receive enough stimulation, then the body will not react well enough to lubricate. Or if they are very afraid about what's going to happen, or they don't feel comfortable. So that's the arousal problem.
So is there any difference between stimulating a premenopausal woman and a postmenopausal woman? Is there any difference?
I think that
should we teach men separately, because men can present with ED if the woman is having, because here like it is a very one-with-one partnership.
Yeah.
So if the postmenopausal lady is not lubricating properly, men comes and tell me, sir, I'm not having any desire to have sex.
No.
So then I inquire, how is your wife? She's equally non-desirous.
Yeah.
Then if she is not having proper sex stimuli, the men loses the same.
Yeah.
So how should we address this issue in both men and women?
I think it's always good to educate both men and women. I think it's good to educate about how the genitals work.
Okay.
And I think it's good to educate men about women need stimulation to become aroused. So if the man just presents with an erection and say, now I want to have sex, and she hasn't been stimulated, she's not going to be aroused, and then it's going to hurt.
Okay.
So it's a good idea to teach about how the genitals, where's the clitoris, how do you stimulate. And we know from studies that postmenopausal women can lubricate, but maybe they need more stimulation. So sometimes what happens with older couples is that she needs more stimulation because she's postmenopausal, and maybe his erections are a little bit weaker because he's getting old. And then she's a little bit dry, he has a weaker erection, and then it becomes very difficult. So we need to recognize that both men and women need more stimulation when they get older. Men do that too. So if you just continue doing what you always did, that might not be good enough. So I think what you're saying about educating is very, very important, to talk about also touching the rest of the body, not only the genitals.
But what happens when we address them, they tend to have an experience, they tend to feel like they are more experienced. And they deny the concept of teaching them. How would you address that issue?
I think that's what you're doing now. You need to educate people. You need to educate healthcare people. You need to educate nurses that maybe can talk to patients. You need to, if possible, educate people in the school, in the older classes when they start being sexually active. But it can take a long time.